great community program. I heard a lot of good recommendations about it. And one of the things that drew me to the program was the ability to have an academic feel and academic connections with Henry Ford Hospital at the main hospital downtown, but still get the community feel and the family feel of a bread and butter general surgery program. So we kind of get the best of both worlds with a community feel, community hospital, general surgery, as well as having the ability to have the benefits of an academic center.
I think we have excellent bread and butter general surgery cases. The residents are like one big family. We have a great relationship with our attendings. What do you think, Zach?
Yeah, I second that. I think we have a great relationship with our attendings. They're always willing to teach us, get us involved in the OR, help us with research or any postgraduate opportunities, and are always just somebody that you can text, call, and be part of your mentorship at this program.
Yeah.
So one of my favorite aspects of the program is the culture and environment. I would describe it as one in which you're held to high expectations by your attendings and your colleagues, but at the same time it's a very friendly culture in which it's not malignant, but at the same time you're held to high expectations. So it strikes the ideal balance for an environment in which you're really enabled to grow. So as long as you come here and you work hard, I think that this program produces outstanding surgeons. So I think it would be a great place to train.
So I think my favorite thing about this program is that we're really like a family. We all come together, we all hang out outside of work, we just get along really well. It's a really good cohesive unit, and I think that's invaluable when you're talking about residency programs because we're just spending so much time together. So it's wonderful to be around people that are great to work with.
I think really how much it feels like a family. Coming from South Carolina, I'm pretty far from home. So, I've made a lot of really good friends, lifelong friends through the program, through my fellow residents. And I think just the collegiality that we have amongst each other, as well as our faculty members, they're always there to help, whether it's clinical situation or, personal advice about our future. They're always a phone call away and are willing to help us.
Most of our time is spent here at Henry Ford Wyandotte, and here we get large volume bread and butter general surgery cases. We do a lot of laparoscopic surgeries here, and we do some outside rotations as well. And actually, in going in those outside rotations, one thing that I learned is experience in laparoscopic surgery is not necessarily equal across all programs, and I think our program does an excellent job in training residents in laparoscopic skills and bread and butter general surgery. If you come here, you would be very comfortable by the time that you graduate in lap choles, lap appies, hernias, all bread and butter general surgery you would be very comfortable with. With regard to some of our out rotations, I think we also do a pretty good job of exposing us to other environments as well. For trauma, we go to DMC Sinai Grace Hospital, which is one of the top hospitals in the country for penetrating trauma in terms of volume. We also go to Henry Ford, Maine in Detroit for SICU and transplant. You also have the option of going there for elective rotations as well. One thing I appreciate about going to Henry Ford downtown for those rotations is you do get exposure to a more, traditional academic, large, academic environment. Whereas at Wyandotte, this is more of a it's a large hospital with more of a community hospital feel. We are on a first name basis with most of our nurses here. We have a very good relationship with nursing here. So I think overall, by the end of residency, you feel very comfortable in very different environments.
And when I was looking at programs, I was looking at some programs close to home that would train me to be a good general surgeon, possibly with the option to go into fellowship. So that's really what brought me to looking at Henry Ford Wyandotte as a program. I liked the fact that it's associated with a larger center, so we have some stability and some more opportunities through that with rotations in trauma, as well as we do children's surgery down in Dayton. And then also I looked at the residents' relationship with each other, and I wanted to find a place where everyone got along well, because 5 years is a long time to work with people that maybe you don't enjoy so much. So I was really happy to see how well the residents got along with each other.
My favorite thing about working in Wyandotte is that the sense of camaraderie I get with my peers, the fact that I can call on attendings for different consulting services directly, I like the atmosphere of living amongst my family, basically. I like that the food's great in the hospital. The cafeteria is really good. If I could go back and do it all over again, I would choose the exact same thing I did the first time. It's a really welcoming place, and even when you go and rotate in other hospitals, people speak very highly of you and speak highly of the people that come from Wyandotte, and that's a blessing.
I live in Dearborn, Michigan. I really like it. There's lots of great diversity, lots of great food, and it's centrally located both to the hospital, Detroit, and anywhere else in the surrounding suburbs you want to go to.
And I live here in Wyandotte, very close to the hospital, lots of nice places to live, close to Detroit, and right across from Canada.
I'm a first year, so I've been here about a month now, and my wife and I live a couple blocks away from the Detroit River, so we love going down to the river and just walking along it. It's really pretty. We're not expecting that when we found out I matched into Detroit. And then also the diversity of cases. So we've got a lot, general surgery is the main focus here, and so multiple attendings do things differently, whether it be robotic, laparoscopic, or open. So I think as a graduating senior, I'll be really comfortable with multiple ways to treat similar issues.
So I live in downtown Detroit. I'm actually from the north suburbs of Detroit, so this is home for me, but getting an opportunity to live in downtown has been so much fun. It's such a vibrant city, and I think for me that's really interesting because it hasn't always been. But living downtown is a ton of fun. Usually there's tons of games you can go to, the Red Wings, the Pistons, the Tigers, the Lions, everyone's right downtown, so it's lots of fun things to do downtown. There's also the Riverwalk, there's tons of fun restaurants, there's just a lot of life downtown, and it's a excellent place to get away when we have free time.
My plan after residency is to do a colorectal fellowship. We have great colorectal surgeries here at this program, and I've also been able to do an elective at Henry Ford, Maine, and I'm interested in pursuing colorectal.
And with our great numbers of bread and butter general surgery cases, I'm planning to do acute care surgery after residency.
As of right now, I'm thinking about going into plastic surgery. I'm very excited about that. I've gotten some exposure to plastics here, and then we also get an opportunity to do an elective rotation as a third-year resident. So I'm planning on doing a plastic surgery elective at Henry Ford, Maine, downtown.
Henry Ford Wyandotte is a very welcoming environment where the residents treat each other with respect and work hard to help each other, not just with their own personal work. And we're given the opportunities to learn a lot of surgery here.
My name is Sherry Johnson. I went to Henry Ford Wyandotte General Surgery Residency from 2013 to 2018. Following that, I went to University of Arkansas for a breast surgery oncology fellowship. I'm now in Anchorage, Alaska, my hometown, where I just completed my first year of being attending, doing about 50% breast cancer and 50% general surgery. Dr. Baydoun asked me to send him a little short video of what this program has meant to me for the next interviewing class. Wyandotte is unique in that it's a very strong, heavy, general surgery based community program, but then it has access to the main Henry Ford health system with exposure to research, transplant, level 1 traumas, blunt and penetrating, surgical ICU. There are pediatric electives as well as access to other electives as well. Over the last 7 years, the residents that I came up with and have known since who have graduated have all gone to their hometowns or their desired locations, and they've all are very happy with the training that they got at Wyandotte. They're all safe, competent general surgeons. And over the last 5 years, we've actually graduated a few residents to go on to pretty competitive fellowships, including breast surgery oncology fellowships, critical care fellowships, minimally invasive fellowships. All of those are markers of what a good program is. Knowing what I know now, being in Anchorage, being at my local community hospitals, doing bread and butter general surgery, acute care surgery on emergency room call, taking care of breast cancer patients, if I had to do it again and choose a general surgery residency, Henry Ford Wyandotte would be the place that I would choose. Thanks.
My name's Andy Holly. I'm a general surgeon at Magnolia Regional Health Center in Corinth, Mississippi. I practice all facets of general surgery, including some advanced laparoscopic surgery, including sleeve gastrectomy, period. My surgical training was at Henry Ford Wyandotte Hospital in Detroit, Michigan, or outside of Detroit in Wyandotte, period. I had an excellent experience there. Felt like my surgical training was very good. I enjoyed my time there, had excellent rapport with the physicians and staff there, and felt like that they really took an interest in me and helped me become the surgeon that I needed to be for myself, my family, and our community. I really felt like our surgical education there was really good with Dr. Moe. He took a lot of time and interest in us and making sure that we knew things that we needed to know for our surgical boards, and I felt very well prepared to take both my written and my oral surgical boards.
I don't know how to take this. We don't even know how to use it.
Ooh, getting a little much. Yeah, keep it rolling. Yeah. Go, Adel.